Hey YouTube, my name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. I am in the middle of a 30 for 30 challenge, 30 videos in 30 days. Today is day 4. And today we're going to talk about obsessive compulsive disorder. Many people ask me, well, what is obsessive compulsive disorder? Maybe it's just a routine. People say, how do I know if I have obsessive compulsive disorder? And today we're going to talk about the difference between a routine versus obsessive compulsive disorder. And I'm going to go through the features of obsessive compulsive disorder. And I'm going to finish by reviewing an instrument called the Y-Box, the Yale Brown Obsessive Compulsive Scale. And we'll go from there. So if you like what you have to see today, hit the like button, subscribe, hit the notifications tab, and here we go. So the first thing I want to distinguish is between a normal routine versus obsessive compulsive disorder. What we see is most people find it comforting to follow routines, and it helps them as they're carrying out everyday activities. And research suggests that about 40% of people become irritated if they have to depart from their routines. Now, if you look on the right, you'll see the percentage of the population who follows a given routine, something like buttoning up a shirt. You'll see 3 out of every 4 people button a shirt top to bottom. And then in terms of other things, brushing teeth up to down, sleeping on one's left side versus right side, and things like that. So we all have routines. It provides structure, it provides comfort, it helps us do everyday activities perfectly. But now let's distinguish between a normal routine or needing things to be a certain way versus obsessive compulsive disorder. Obsessive compulsive disorder is a chronic condition in which 6 months or longer, a person either has the repeated occurrence of obsessions or compulsions or both, and the amount of time that their focus on the obsession is considerable. Generally speaking, if you're spending about an hour or more either on the obsession, compulsion, or a combination of the two, it is likely an obsessive compulsive pattern. And for the disorder, we also have to see some level of distress or impairment. So the diagnosis is called for when you feel that the obsession or compulsion is excessive or unreasonable and it interferes with your functioning. So all of that can be seen on that slide. Now, what are obsessions? What are compulsions? An obsession is a persistent irrational thought that preoccupies the person. So it's almost as if it's an intrusive thought that is on a loop. So a person becomes obsessed or preoccupied that they keep thinking and thinking and thinking about whatever it is. And that creates anxiety. And that oftentimes leads to compulsions, as you're about to see. But what are some common obsessions? Well, people obsess over germs or cleanliness. People obsess over like fear of something terrible happening, or some people need things to be a certain way, structured, orderly, exact. And if anything's out of place, it will induce significant level of distress. So the obsession is the persistent, irrational, or intrusive thought. The compulsion is the irrational or repetitive behavior that the person needs to perform in order to reduce the anxiety associated with an obsession. So what are some common compulsions? One is excessive washing of one's hands, grooming, needing to tap, needing to repeat rituals over and over and over. Safety rituals like checking one's locks, doors, appliances, and so forth. Any one of these are a compulsion, right? So let's show how they could be connected. Suppose an individual was obsessed with germs and cleanliness, and they touch a doorknob, and the doorknob isn't in their home, it might be outside in the world, and they touch that doorknob, it's going to induce anxiety to the point that all they can think about is the fact that their hand is unclean. And it's going to nag at them and nag at them and nag at them until they do something about it. So the compulsion would be, what do you do with that unclean hand? What do you do with the seemingly the germs on your hands? The compulsion would be to wash one's hands, Purell one's hands, and so forth. And until you either wash your hands or Purell your hand, you're going to be in a significant level of distress. Now, what's interesting about the compulsion is it does give a temporary relief or comfort from the whatever you were obsessed about, but it reinforces, it makes that obsession stronger in the future. So what we tend to see is people wind up in a vicious cycle where they have this obsessive thought that I gotta wash my hands. That induces anxiety because they're not able to wash their hands right away or Purell their hands. But eventually they find a place, they may even pull over at a rest stop randomly or go out of their way to wash their hands, even though that interferes with what they're trying to do. Then they're going to do the compulsory hand washing or Purelling, and then they're going to feel that relief. But I said, the obsession leads to the compulsion, but the compulsion reinforces the previous obsession. So we go round and round. Now, I also said that there's some level of dysfunction associated with that. So when we think about what would the dysfunction be? What happens when a person washes their hands too much? The skin is going to dry, the skin is going to crack, and they might actually bleed, right? So that is a problem. So many times if a person has a cleanliness obsession, that does really cause damage to their hands when they're washing excessively. So that's the cycle of OCD. That's the perseverative, repetitive thought that comes in. Now, how prevalent is OCD in our society? Well, we see that there's roughly a 1 to 2% incidence rates in a given year and a 2 to 3% across the lifetime. So it's there. It's not the most common disorder, but it's prevalent enough. Now, we do see no gender differences, no ethnic differences. This condition occurs most commonly in early adulthood, but I will tell you that it can occur at any point in the lifespan. Early adulthood is the common case. 40% of people who have OCD seek treatment. And again, if we're thinking about the patterns, that is higher than other anxiety disorders that we talked about earlier. So it's higher because it's more distressing. It causes more dysfunction in one's life and so forth. So it shouldn't shock you that there's a large percentage of people with OCD who wind up in treatment. Now, OCD used to be part of the anxiety category of disorders. So it was one big, broad chapter. And in the DSM-5, they took that big chapter of anxiety, obsessive compulsive, and stress-related conditions and separated them into 3. So now in the DSM-5, obsessive compulsive disorder has its own home. But there are other obsessive compulsive related conditions that a person could experience. Things like hoarding. Hoarding disorder occurs when a person has an extreme attachment to things, so they collect them, even though objectively they may not have monetary value. It creates a personal sentimental value. And if we're working with a person with hoarding disorder, they will struggle to get rid of things. It is painful. It'll cause them distress. They might fight you. And, if you're interested, there is a good show called Hoarders, which really highlights this feature. We also know that as a function of not being able to get rid of things or having an exaggerated attachment to objects, people start to accumulate an extraordinary number of possessions, and their houses become cluttered, and in some cases become uninhabitable. They cannot live in them. And this causes them distress, or people around them distress. So that's hoarding disorder. So that's one of the additional conditions that were added. We also have trichotillomania. Trichotillomania is pulling out one's hair, or a hair pulling disorder. This person, in periods of distress, compulsively pulls out their hair, and even though they try to stop, it becomes hard for them to. And in periods of anxiety and stress, it is exacerbated, and that's their go-to. And as a function of this, it causes them distress and impairment, whether it be to their health or whether it be to their appearance or so forth. We also have excoriation disorder. Excoriation disorder is similar to trichotillomania in the fact that it's skin picking. So instead of hair pulling, it's skin picking. But if you dig at your skin repeatedly, it's going to bleed. It's going to cause scarring, and it's going to cause physical harm. And then the last one that I'm going to talk about in this video is body dysmorphic disorder. Now, body dysmorphic disorder is when a person has a preoccupation with having some deficit or flaw in their appearance. More often than not, it's trivial to other people. So if I had body dysmorphic disorder, I might be unhappy with my ears. I might say there's something wrong with the shape of my ears. And every time I look in the mirror and I look at my ears, and I feel that there's something wrong with them, when in reality, there's nothing wrong with my ears. So what do people do? People go into compulsive checking in the mirror. They often seek feedback from other people. They compare themselves to other people. Some people wind up going for plastic surgery. And I'm sure if you watch television, there are tons of videos about plastic surgery. I think botched is one of them, but many times it comes from body dysmorphia, where a person is getting plastic surgery after plastic surgery after plastic surgery. And that which started out as fine, it can become problematic based on all the surgeries, and you run the risk of a botched surgery as a function of that. And obviously this causes a person distress and unhappiness with their general appearance, and they feel inadequate. So these are the videos. So to recap, the DSM-5 has obsessive compulsive disorder, obsessive compulsive personality disorder, which I didn't mention, but I'll have a separate video on it. It has hoarding disorder, trichotillomania, excoriation disorder, and body dysmorphic disorder as a new category called obsessive compulsive related disorders. Now, I want to finish this video by showing you a clinical instrument that we use to kind of get a sense of, well, what does this individual's OCD look like? So I'm going to pull up the Yale Brown Obsessive Compulsive Scale, which is oftentimes referred to as the Y box. Okay, so here is the Y box, or the Yale Brown Obsessive Compulsive Scale. And what we do is we're trying to get a sense of, well, what are the obsessions? What are the compulsions? So we're trying to get a sense of your struggles. So if we were to look at this, we might measure, well, how much time is occupied by obsessions or obsessional thinking. And I said, if you have a score of 1 hour or more related to obsessions or compulsions, it's probably an OCD condition. You also, instead of just looking at time, we could look at, well, how much dysfunction is caused? Is your work life, your school life, your social life, your romantic life, any aspect of your life, is it impacted adversely because of the OCD? And we have a series of a range of scores there. And then we have the distress, right? So how bothersome is this to you? And then we have resistance against obsessions. If you have an intrusive or obsessive thought, how often do you try and shift your attention, redirect your attention away from this obsessive thought? Well, we could see a person, if they're doing it all the time, that means that they're fighting against the OCD tendency. But if they're, on the other end, completely and willingly giving in or yielding to the obsessions, that's more problematic. So, and then we look at a measure of control and how much time is spent performing the compulsive behavior and the interference due to compulsive behavior, the distress, the resistance to compulsion, and the relatively subjective evaluation of control over the compulsions. So it's the same questions for the obsessions as compulsions to see how strong are your obsessions, how strong are your compulsions, but that still does not give me a sense of which obsessions or which compulsions does this person have. So the symptom checklist, which is part of the Y box, allows us to mark both principal symptoms, right, which are characteristic, and it allows us to acknowledge past obsessions and compulsions. And you'll see, I didn't go through earlier all of the forms of obsessions and compulsions, but you can have obsessions about aggression or contamination or sex or hoarding or religion or symmetry, exactness. And then you could have compulsions related to cleaning or of hand washing, checking, repeating over and over the same routine or behavior, counting, tapping, arranging, hoarding, and so forth. So this is a very, very versatile instrument because it both gives what the symptoms are, and it gives, the level of impairment in a person's life. So it gives us a lot of information as clinicians to know how this person is struggling. So that's the video, guys. If you like the video, if you found it useful, hit the like button, hit the subscribe button, click the notifications icon, and that allows me to share this video with a broader audience and create more videos of this kind. Take care, everybody.